Hi everybody, good afternoon. Am I audible and visible, guys? Okay, so without taking too much of your time, so let us start the class for today. So now today it is an important class where we will be discussing about preventive obs pediatrics, RMNCAH+N, as well as we will be talking about healthcare delivery system. Okay, so it has a lot of important topics today. Oh, I forgot to send the PDF. Let me give you one question and then I'm going to share the PDF as well. Okay, so alright, so like you can see, we are on 9th session and let us move forward. This is your first question. Please do it. Meanwhile, I'll just send out the PDF. Give me 1 second, okay? एक second, रुको. I'll send the PDF. Just a second. Okay, I hope you all are answering this question, guys. I didn't realize the time today. I thought I was early, but then I realized I was late. Okay, so which of the following, so like I said, we'll be doing preventive obs in pediatrics also today. ठीक है, so आज question क्या है, which of the following is true about at-risk infant? Now there is at-risk infant. Single working mother, बच्चे single या working mother के are at-risk infant, guys. Okay. Birth order more than equal to 3, no. Birth order more than equal to 5. Birth weight 2.8 kg. 2.8 kg is the average birth weight of Indian babies. That doesn't put it as a low birth weight. Okay, so this is birth weight of 2.8 is not its average birth weight of Indian babies. Weight below 85% expected weight, no, 70% expected weight. Artificial feeding, yes, artificial feeding as well. So what did you answer, guys? Some of you really got this correct. Very good. Most of you in fact got it correct. A and E. So I'll just show you the criteria for at-risk infant, guys. Please remember this is also a PYQ, NEETPG, FMGE सारे एग्जाम्स में आया हुआ है. Birth weight less than 2.5, not 2.8, because 2.8 is the average birth weight of Indian babies. Twins, birth order, कितना है birth order? 5 and more, not 3 and more. Artificial feeding, like I said, weight below 70% of expected weight. That means second and third degrees of malnutrition. Failure to gain weight during 3 successive months. Okay, failure to thrive. Children with PEM, diarrhea, working mother, one parent. Now this question has come before. It can also come as at-risk या high-risk pregnancies. This you can revise from OBG as well, but I have listed it down over here for you. These are all 3-star question, guys. At-risk infant, at-risk, high-risk pregnancies. High-risk pregnancies में elderly, primary, 30 and above. Look at this, short stature 140 centimeter and less. They can write it as 150. It is 140. और इसमें एक और चीज़ देखो, 3 or more spontaneous abortion. Rest you will be able to figure out. but जिनमें numbers होते हैं ना, like birth order 5 or more. Here you have 3 or more spontaneous abortion. So remember this as well. Okay, moving to the next. So at-risk infant, high-risk pregnancies. I didn't share yesterday's PDF. Okay, I'll share it. I'm so sorry. It might have skipped my mind. I'll send out yesterday's PDF also. Okay, maternal mortality ratio for a country is best given by, what is your answer? Maternal mortality ratio. Now, when we see the word ratio, numerator is not a part of denominator. है ना? So, obviously, it is live births. And I have told you many times that maternal deaths or maternal mortality is the only place where multiplier is 1 lakh. It is not 1000, it is 1 lakh. So most of you are getting it correct. It is maternal deaths per, all of you are getting it correct, per 1 lakh live births. You should not make a mistake in this, guys. Okay, now let me just quickly revise with you. I'll take a fresh page and quickly talk about, or let's see here only. maternal mortality rate, what is that? If I ask you maternal mortality rate, and there is another thing which is maternal mortality ratio, now in both guys you need to remember कि तुम्हारा जो multiplier है that is 1 lakh. okay, here also it is 1 lakh, the only place. We will revise all this in formulas as well when we do our numerical based session. So we will revise that. Now this is number of maternal deaths. all right, this is number of maternal deaths per 1 lakh rate hai. So numerator has to be a part of denominator. So per 1 lakh women in reproductive age group, all right, women in reproductive age group 15 to 49 years, but in ratio it is what? Number of maternal deaths per 1 lakh, what is it going to be? Live births. ठीक है. And what is maternal death? क्या होता है? Maternal death is the death during antenatal period. It is the death during ANC period. It is the death during delivery, or another MCQ, up to how many days post delivery, or up to 42 days, or 6 weeks post delivery. It is a death due to pregnancy and its related causes. Okay, we have to exclude accidental/incidental causes. Remember this, exclude accidental/incidental causes. I will talk to you about this when we discuss numericals, like a pregnant woman slips in the washroom and dies, falls from a flight of stairs, suffers an electric shock, वो सब आपको कोई भी include नहीं करना. Clear? All this will be repeated once we have the numerical class as well. Okay, infant mortality rate, देखो हर एक time, this was a question in 2018, some NEETPG FMGE किसी में तो था, this was again repeated in 2023, so they do ask you the formula. So what is it? Infant mortality rate is typically stated as rate per how many live births. What is the answer over here? This is 1000. Very good. For all the child health formulas, the multiplier is 1000 guys. That I will revise with you when we do the numerical class. Whether it is, देखो NMR है, IMR है, under 5 mortality rate. Okay, everywhere your multiplier is 1000, everywhere your multiplier is 1000, everywhere it is 1000. And what is your denominator? Live birth. Neonatal क्या होता है? Death first 28 days. That is understood in a year in a community. Infant mortality rate, death 0 to 1 year. ठीक है. Under 5 death 0 to 5 years. ठीक है. All these things per 1000 live births. Most common cause, please don't get confused, most common cause, whether I say NMR, whether I say IMR, whether I say under 5, it is prematurity. All right, prematurity, also you could say low birth weight. If you have to mark one, we will go for prematurity. And most common cause of maternal mortality guys, most common cause of maternal mortality, most common direct cause of maternal mortality. Direct cause of maternal mortality क्या है? Most common direct cause of maternal mortality guys, you must remember it is hemorrhage. ठीक है. PPH, it is postpartum period में सबसे ज़्यादा होता है. And indirect cause क्या है? What about indirect cause? So indirect cause is anemia. Clear? Okay, let's go to the next one. You know, they can also frame a question like maximum maternal mortality happens during the antenatal period, during delivery, or is it postpartum period? What will you answer? Maximum maternal mortality takes place during antenatal period, during delivery, or is it postpartum? Very good. Maximum is postpartum, instead of asking like direct cause. ठीक है. Alright, moving ahead. Sensitive parameter of combined obstetrics and pediatric care in the country is. These questions are favorite of examiners. They do ask you about such things. What is your answer? Combined obstetric and pediatric care. That means when the baby is in the womb as well as when the baby is outside. Baby has come out. So we'll take that indicator which includes both of those things. So that is perinatal mortality rate. Now let us discuss once what is perinatal mortality rate. Like I said guys, you will have 1000 as the multiplier. Okay, you will have 1000 as the multiplier. And remember one more thing. Here it is death beyond 28 weeks gestation. I mean, whenever a baby dies in the womb at or beyond 28 weeks, India mein period of viability is considered as 28 weeks, 7 months of pregnancy. WHO takes it as 22 weeks. So death beyond 28 weeks gestation plus early neonatal death. What is early neonatal death? So it is for 0 to 7 days. Now see, for less developed countries or for developing countries, the data on stillbirth is lacking. So हम लोग क्या करते हैं, in countries which don't have proper records, we take the denominator as live births. ठीक है? Countries where no proper record, countries with low records, okay, less records available. Otherwise countries जहाँ पे properly सब कुछ developed है, we take it as total births. But wherever you have low records, जहाँ पे lacking है records, we take it as live births. Clear? So this is very very important. And if a baby suppose dies in the womb at let's say 29 weeks gestation, will you call it as abortion or will you call it as stillbirth? Did you understand the question? Death of a baby, death at 29 weeks gestation, इसको तुम abortion में गिनना चाहोगे या इसको आप still birth में गिनना चाहोगे? What is it that you're going to write over here? Yes, it is stillbirth. Remember the criteria for stillbirth, guys. When do you call a baby stillborn? Let me write it here. When do you call a baby stillborn? Stillborn means no signs of life. Okay, the baby didn't show any signs of life. Now, no signs of life you can include when the gestational age is beyond 28 weeks. If you don't have that, or you can take, okay, weight should be beyond or at least 1 kg, because at 7 months the weight of the baby in the womb is 1 kg. Or you could also say length कितना होगा? 35 centimeters. If any of these criteria, you can call it as a stillbirth. अगर gestational age नहीं है, then we can call it as weight. If it was 500 grams, then we will call it as abortion. Clear? That is very very important. Okay, going to the next question. Best index of for measurement health indicator in society. Best index for measurement health indicator in society. Best index health indicator in society. क्योंकि मेगा IMR में it is not reflecting the time when the baby was in the womb. It is from birth. अब इसका आंसर IMR है. ठीक है, IMR is the answer at a lot of places. Best indicator health status of a country, health status, best indicator, ठीक है, best index of health status, best index of health status of a country, best index of availability, utilization, effectiveness of healthcare services, availability, utilization, effectiveness of healthcare services. All right, so all these are what? All these are going to be your IMR. Clear? But if it is according to UN, everything same thing. If they ask you according to UN, United Nations, best indicator of health status, best indicator of socio-economic development, if they say according to UN, guys, your answer is under 5 mortality rate. If UN is not mentioned, it is this one. If they ask you best indicator for healthcare delivery services, best indicator of healthcare delivery services, services, healthcare delivery services. So if the question is best indicator of healthcare delivery services, in that case your answer is MMR. ठीक है, maternal mortality ratio. Clear? Combined obstetrics and pediatrics care, PMR. चलो, let's go to the next one. Marasmus में क्या हो जाता है? Mid upper arm circumference. Yeah. Good everybody, because you all know marasmus is SAM child, and SAM के लिए what are the criteria? Severe acute malnutrition. So what are the criteria for SAM, guys? So if you have to talk about the criteria for SAM child, okay, if you have to talk about the criteria for SAM child, what is it that you're going to write? Severe acute malnutrition. तो आप इसमें क्या लिखोगे? Number 1, you can write low weight for height below -3 SD, ठीक है, and or mid upper arm circumference Shakir's tape 11.5 centimeters or 115 millimeters, ठीक है, and or you could also say bilateral pitting edema, bilateral pitting edema. Clear? Bilateral pitting edema, we could also say that. So over here, mid upper arm circumference less than 11.5 centimeters. This falls in which color zone, guys? This falls in the red zone. This falls in the red zone. Now kwashiorkor and marasmus, you must know a couple of things over here. Which condition is more serious, guys? This difference pad lena. I am sorry, I don't have the baby. Oh, I have the baby picture. Which one is kwashiorkor? This one with the protruded belly. This one is kwashiorkor and this one is marasmus. Now remember, kwashiorkor is more common. Kwashiorkor is more kwashiorkor is more serious, and marasmus, everybody, is more common. Marasmus is more common. All right, marasmic baby is more common. You can also do the differences from here. They've asked this. This is a PYQ. Kwashiorkor develops in children whose diets are deficient of protein. Marasmus, both protein and calories. Alright, kwashiorkor occurs in children 6 months and 3 years of age. Marasmus is under 1 year. Alright, here subcutaneous fat preserved, not preserved, that you can do. This is more serious. Enlarged fatty liver है, lethargic है, poor appetite है, needs adequate protein. Marasmus में is a voracious feeder, alert and irritable. ठीक है, so that's the difference between kwashiorkor and marasmus. So I'm sure you understood this question. In marasmic baby, what happens to the mid upper arm circumference? Let's go to the next one. Yeah, this image we have discussed in image based session as well. ये है तुम्हारा Shakir's tape. Green zone mid upper arm circumference is more than 12.5 centimeter. The baby is road to health, no problem at all, everything is good. Yellow zone is mild to moderate malnutrition, mild to moderate malnutrition. All right, mild to moderate malnutrition, where the mid upper arm circumference is 11.5 say 12.5 centimeters, and this is your red zone. This is a SAM child where the mid upper arm circumference is 11.5 centimeters या millimeters. Remember, Shakir's tape हम लोग लेते हैं between 6 months to 5 years. And one more question that comes, it's age independent malnutrition criteria. Okay, age independent criteria to assess malnutrition. Because if you see 6 months का baby हो, 1 year का baby हो, 3 years का baby हो, these values are going to remain the same. So it is age independent malnutrition criteria. All right, age independent malnutrition criteria. So that is very, very important, malnutrition assessment. Clear? Let's go to the next one. आंगनबाड़ी teacher weight and height ले रही है of a 4-year-old and finds out that height for age is below -2. What is the likely cause? Height for age. Height for age, it involves a lot of things. ठीक है, हाइट फॉर एज क्या हो गया? क्रॉनिक malnutrition, राइट? क्रॉनिक malnutrition इज ऑल्सो स्टंटिंग. मतलब ये क्वेश्चन कभी भी डाई आउट नहीं करेगा. इट कीप्स कमिंग, इट कीप्स रिपीटिंग. acute malnutrition is low weight for height, okay, and you can also call this as emaciation slash wasting. Emaciation slash wasting. And what is acute on chronic? If you talk about acute on chronic, guys, if you talk about acute on chronic, that means chronic is there, acute is superimposed, so that is low weight for age. Don't get mixed up over here. All right, let's go to the next question, guys. Can you ask your question towards the end? Otherwise we'll miss out the questions. All right, which of the following should not be included in school health service? All the questions regarding school health from different exams. What is somebody asking something? ओके, डॉक्टर ऑन प्रेमिसेस ज़रूरी नहीं है, ठीक है. डॉक्टर डेंटल आई हेल्थ सर्विसेज, आई हेल्थ चेकअप टीचर भी कर सकती है. स्कूल हेल्थ रिकॉर्ड्स, ऑब्वियसली वी कांट डिनाई हैंडीकैप चिल्ड्रन एजुकेशन. डॉक्टर ऑन प्रेमिसेस इज नॉट अ फिक्स्ड क्राइटेरिया. ही शुड डू अ चेकअप वंस एवरी 6 months. ऑल राइट, ऐसा नहीं है दैट ही शुड बी देयर. चेकअप वंस एवरी 6 months. ऑल राइट, चेकअप वंस एवरी 6 months. नाउ आई विल शो यू सम अदर क्वेश्चन ऑल्सो. Look over here, ideal per capita space for students in a classroom should be 2023 NEETPG, FMGE, both the exams. So what is your answer over here? Ideal per capita space for students in a classroom should be, very good, more than 10 square feet. Okay, more than 10 square feet. Okay, going to the next question. See, 2020. School health is the responsibility of PHC. Right, that is again one of the other MCQs. School health is the responsibility of PHC. Which of the following does not meet the minimum standards of school health? Desk is of minus type, combined windows and doors, 25% of floor space area, maximum 40 students per classroom, one urinal for 10 students and one latrine for 25 students. So of course one urinal हो सकता है for 60 students and one latrine is for 100 students. ऑल्सो इसमें एक चीज़ याद रखना, स्कूल हेल्थ इज़ द रिस्पॉन्सिबिलिटी ऑफ PHC. आयुष्मान भारत इज़ ऑल्सो प्रमोटिंग स्कूल हेल्थ, ठीक है. इट इज़ कंडक्टिंग आयरन फॉलिक एसिड प्रोग्राम इन स्कूल हेल्थ इज being conducted as a part of आयुष्मान भारत ऑल्सो. क्लियर. नाउ आई चेकअप में क्वेश्चन आता है. आई चेकअप, द टीचर इज ट्रेन्ड फॉर दैट. Teacher can do visual acuity less than 6/9. The student is referred, all right, and he will be referred to a paramedical ophthalmic assistant. You can find at a PHC, paramedical ophthalmic assistant, all right, paramedical ophthalmic assistant. One teacher can screen almost 150 students. एक टीचर स्क्रीन कर सकती है 150 स्टूडेंट्स, 150 स्टूडेंट्स. एंड स्कूल हेल्थ कॉन्सेप्ट वाज गिवन बाय, स्कूल हेल्थ कॉन्सेप्ट वाज गिवन बाय गाइस, school health concept. Deworming is included for school health under Ayushman Bharat only, ठीक है. Deworming देना, when I talk Ayushman Bharat in programs I will discuss it. Deworming is included as a part of Ayushman Bharat for school promotion. Sanitary pads provide करना भी included है. Iron folic acid भी है. So that I will take up when we talk about Ayushman Bharat. Okay. School health concept was given by, school health concept was given by guys Bohr committee. All right, school health concept was given by Bohr committee. It was revised by Renuka Roy. Next question, according to WHO, minimum number of ANC visits. What's your answer? या यू रिमेंबर पारुल, स्कूल हेल्थ बच्चों को स्टार्टिंग में स्कूल हेल्थ भेजो, दे फाइंड इट अ बिट बोर, सो बोरिंग कॉन्सेप्ट. School health. Okay. Alright, according to WHO, minimum number of ANC visits is 8. According to Government of India, it is 4. So you can just check out this slide, guys. Recommended अगर एग्जाम में पूछा ANC visits या ideal ANC visits 13 to 14. Minimum ANC visit, alright. Minimum ANC visit 4. Minimum ANC visit, like you can see over here, is 4. This is Government of India. And minimum ANC visit according to WHO, guys, that is 8. Someone can ask how is it 8? So remember, first trimester 1 visit, all right. First trimester 1 visit. Second trimester they can have 2 visits. And if you talk about the third trimester, guys, we are left altogether 8, so we are left with 5 visits. This you should remember it this way. And you know, they can trick you on the exam. WHO ने ना ANC visits को एक term दिया है. Okay, they might choose these term. Antenatal care contact, it's the same thing. It reflects a strong bond or a connection between a health worker and a pregnant female. So don't get confused. According to WHO, this term can also come in your exams. Antenatal care contact. Good, Shahina. Good, guys. Chalo, let's go to the next one. Under JSSK program, pregnant women receive a free antenatal checkup on the ये गलत हो गया. Just tell me the this one free checkup 9th हटा दो, 9th में नहीं जाएंगे. So 9th particularly is for प्रधानमंत्री. JSSK में free checkup कभी भी मिल सकता है. Along with free medicines and deliveries. What is the full form? जननी शिशु सुरक्षा कार्यक्रम. Now remember, JSSK में everything was free. Free delivery, free C-section, free diet, free medicines, free transport, free blood, free referral, everything was free. Okay. Alright, moving to the next one. All facilities are provided in a newborn care corner except, now this can come as an expected MCQ, guys. What is the answer to this, anybody? Newborn care corner कहाँ होता है? Think and answer. Where is newborn care corner? Okay, so I've not got the correct answer so far. Good, we are discussing this. Now see, guys, I'll tell you something. Can I go to the discussion? Okay, Likita has sent out, Harish ने अभी सही दिया. Okay, guys, ये देखो, ये topic है facility based newborn care. Okay, facility based newborn care. Now facility based newborn care में there is a newborn care corner, there is a newborn stabilization unit, and there is a special newborn care unit. ठीक है. Now when you talk about newborn care corner, it is every labor room. हर labor room के साथ, ठीक है, में ही आपको कोने पे दिखता है newborn care corner. You can take care of the normal newborn. You will initiate breastfeeding support. You will identify and refer sick newborn. So if the baby is sick, care तो करोगे ना, care of sick newborn. What do you mean by care of a newborn? Tell me from pediatrics. As soon as the baby comes, you have to take his care. इसका मतलब क्या है? Start playing with the baby? No. What is it that you have to do? Immediate resuscitation if needed. All right. Taking care of the eye, taking care of the cord, preventing hypothermia, all that come on the care of the newborn. You can't start playing with the baby. So even if the baby is sick, you will take care of the sick newborn. But in newborn care corner, this is present in all delivery units. It should be at sub-centers in PHC. सब जगह होता है. But if you talk about newborn stabilization unit, it is next to labor room. It's a separate area, guys, which has been given adjacent to the labor room. Care of normal newborn, breastfeeding support, sick newborn, phototherapy for hyperbilirubinemia, newborn sepsis. लो बर्थ वेट बेबीज यहाँ मैनेज होंगे, बट 1.8 से 2.5 kg तक ओनली. दिस इज वेरी इंपॉर्टेंट गाइस. But if the baby's weight is below 1.8, you can't manage. This is also present in a CHC. You cannot manage there. So what do we do, guys? We have a special newborn care unit which you can also find in district hospitals, and over here same thing, care of newborn, breastfeeding, sick newborn, everything. But here the most important thing is low birth weight, below 1.8 kg को भी आप manage करोगे. And this is a ward, this is a area which has almost 10 to 12 beds. It's like a NICU, okay? It's present in the district hospitals as well. Did you get this question, everybody? It was a slightly different question which has not been asked, but they might ask you. It was once long back asked in AIMS exam, guys, so you should be familiar with these terms. Newborn care corner, तो कभी मत बोलना लो बर्थ वेट. न्यूबॉर्न केयर कॉर्नर मिनिमम सब सेंटर PHC में होता है, वहाँ पे वी कैन स्टार्ट मैनेजिंग low birth weight. So newborn care corners, newborn stabilization unit, special newborn care corners are also there. Okay, let's move to the next question, everybody. JSY keeps coming in exams. A pregnant woman residing in an urban area registers under JSY. All services are provided under this scheme except, what's your answer? गुड. HIV काउंसलिंग एंड टेस्टिंग क्यों होगा? ये तो नेशनल एड्स कंट्रोल प्रोग्राम में होता है, ठीक है. JSY में रिमेंबर वी गिव कैश इंसेंटिव्स फॉर होम फॉर हॉस्पिटल डिलीवरीज, कैश असिस्टेंस फॉर इंस्टीट्यूशनल डिलीवरीज, सेफ अबॉर्शन सर्विसेज भी प्रोवाइड हो रही हैं, मेटर्नल डेथ रिव्यूज़ भी किए जा रहे हैं. नाउ सर्विसेज यू कैन रीड दिस, वी कैन टॉक अबाउट इट. कैश दिया जा रहा है. सेफ मदरहुड सर्विसेज. व्हेन आई टॉक अबाउट सेफ मदरहुड सर्विसेज, व्हाट डू आई मीन? ANC care, TB vaccine, all those. Celebrate Village Health Nutrition Day. This is celebrated once a month. Where? At Anganwadi centers. Once a month at Anganwadi centers. We'll also do a maternal death review, pregnancy tracking, and we also do a safe abortion services. याद रखना, ठीक है? And that is very, very important. The main person who's behind celebrating Village Health and Nutrition Day, guys, the main person behind organizing again is your ASHA worker. We'll talk about ASHA worker today. Now tell me this one. 2022 exam में cash पूछा. Can you see how the question on JSY keeps coming? Although it's a very old program, guys. It's a scheme of 2005. जब NRHM आया था, the concept of ASHA came. It is a scheme of that time. Still questions are coming, है ना? Okay, ASHA institutional delivery. अब यहाँ पे देखो मध्य प्रदेश. What is the relevance of this state over here? What is the relevance of the state over here, guys? What is the relevance of this state over here? So you have to remember something which is very, very important. Let me take you to a important line here. Madhya Pradesh, यहाँ पे देखो, just have this LPS, low performing state. Low performing state, that means there is lower percentage of institutional deliveries based on hospital deliveries. Low performing states basically होते हैं, guys, बीमारू states. Okay, बिहार आ गया, BI से बिहार, झारखंड आ गया, MP. अब MP के साथ तुम एक और लगा लो UP. Alright, A में असम, R से राजस्थान, ठीक है, MP, UP. But we have added a couple of things more over here because now they have separated. जैसे छत्तीसगढ़ अलग हो गया, so छत्तीसगढ़ is separate now. असम हो गया, JNK, you should remember. बिहार, झारखंड, MP, Assam, Rajasthan, UP. If they mention these, other than that, of course, Chhattisgarh, Odisha, if they mention these, they are all what? Low performing state. Now, for low performing state, and incentives are always more in rural areas, less in urban areas. And incentives are always going to be more for mother and low for ASHA. तो आशा चाहे लो परफॉर्मिंग स्टेट हो, हाई परफॉर्मिंग स्टेट है. इन रूरल एरियाज इट इज 600. इन अर्बन एरियाज आशा का पैकेज इज 400. बट फॉर अ मदर फ्रॉम रूरल एरिया इट्स वेरी डिफिकल्ट टू ब्रिंग हर फ्रॉम द विलेज टू द हॉस्पिटल टू अ सब सेंटर ऑल्सो. सो लो परफॉर्मिंग स्टेट इट इज 1400. हाई परफॉर्मिंग स्टेट हाफ ऑफ दैट 700. In your urban areas 400, 4000 and 600. Now we have to see she's coming from MP. Now is she coming from MP फ्रॉम रूरल एरियाज? तो रूरल एमपी से आ रही है, तो रूरल एमपी से आ रही है तो उसको कितना दिया जाएगा? इफ़ यू लुक एट द क्वेश्चन ओवर हियर, शी इज़ कमिंग फ्रॉम द रूरल एरियाज फ्रॉम एमपी, सो शी विल बी गिवन हाउ मच? 1400 for the mother and 600 for the ASHA. So these are a couple of things that you have to make sure over here, that you see low performing state kya hai, you see high performing state kya hai. Are we talking about the mother, are we talking about the ASHA worker? ठीक है, ASHA worker always fixed. Rural areas 600, whether low performing, high performing, urban states it is areas it is 400. One more thing guys that you need to remember over here everybody, एक second I wanted to show you. क्या तुम कैश इंसेंटिव देते हो फॉर होम डिलीवरी अंडर JS5 जननी सुरक्षा योजना? डू वी गिव कैश इंसेंटिव फॉर होम डिलीवरी अंडर दिस? सो प्लीज रिमेंबर, इन केस ऑफ होम डिलीवरी ऑल्सो अ कैश इंसेंटिव इज गिवन टू ऑफ ₹500 फॉर बिलो पॉवर्टी लाइन प्रेग्नेंट वुमन. आप 500 दे देते हो बिलो पॉवर्टी लाइन प्रेग्नेंट वुमन को. इफ शी डजंट अग्री, ठीक है, सो बिलो पॉवर्टी लाइन प्रेग्नेंट वुमन विल give. Low performing state all pregnant women is given, high performing state only below poverty lines are given and SC/ST women are given. But in low performing state, for below poverty line and pregnant women, in case of home delivery also we give ₹500. Clear? JSY, I'm stressing on JSY because keeps repeating. Suman का full form? ऐसे क्यों हो रहा है? Why am I getting separate answers? A couple of you are writing. Suman is सुरक्षित. SU से सुरक्षित. It is सुरक्षित. And M stands for मातृत्व, and AN stands for आश्वासन. All right. सुरक्षित, मातृत्व, आश्वासन. So we are giving minimum how many visits? 4 antenatal checkups. Medicine, diagnostic tests and blood services to mother during pregnancy, during delivery, also after delivery till 42 days. नहीं guys, till 6 weeks. We are also talking about proper care with respect and dignity, and of course it has been launched by Ministry of Health and Family Welfare. So this is not 42 days, sorry, this is not 6 weeks. Under Suman the services are provided up to 6 months. That's the speciality of Suman. We will provide services to females even after 6 months of delivery. So see over here, this is the logo of Suman. Have told you a couple of times now. Everything, you know, this was a latest scheme. All the services that were being provided under JSY, JSSK, जितने maternal health schemes थे, all were included under Suman, like free. Everything is free, ठीक है? Antenatal checkups, deliveries are free, free medicines. The important thing to note over here is everything free during pregnancy, during delivery, after delivery till 6 months, and for baby up to 1 year. So you will provide it free till 6 months. Also we will provide it freely for baby up to 1 year. Also we are talking about proper care with respect and dignity, and also grievance redressal mechanisms. Am I clear? Will you remember this? 6 months as well as up to 1 year. Got it? Everybody got this clear? Suman initiative बहुत important है. We also have a Suman charter. In the exam you can get a question, quality. ठीक है? Quality initiative, quality, proper care, respect, dignity. It is Suman. These logos have been discussed in image. This is Lakshya guys. Labor room improvement initiative. This is 9th of every month. Free ANC services. प्रधानमंत्री सुरक्षित मातृत्व अभियान. Free ANC services. किसको दिया जाएगा free ANC services guys? So we will give to women particularly in 2nd, 3rd trimester. And you know this even a private center can give. ऐसा नहीं है कि सिर्फ government hospitals, private setups which are being incentivized by the government, they can also provide services. In this only we give a red card for high risk pregnancy to identify high risk. ओके, ग्रीन कार्ड किस में देते हो? नो रिस्क प्रेगनेंसी. देन वी गिव अ ब्लू कार्ड किस में देते हो? PIH. एंड वी ऑल्सो गिव अ येलो कार्ड इज फॉर एनी अदर कोमॉर्बिडिटी. ऑल मेटर्नल हेल्थ इनिशिएटिव्स जितने भी है आर अंडर मिनिस्ट्री ऑफ हेल्थ एंड family welfare. All maternal health initiatives are under Ministry of Health and Family Welfare. But remember one thing, this one that you can read, what is the name of this? Pradhan Mantri. This is Pradhan Mantri Matru Vandana Yojana. Pradhan Mantri Matru Vandana Yojana. Pradhan Mantri Matru Vandana Yojana में guys एक cash incentive दिया जाता है ₹5,000 in 2 installments. Earlier it was 3 installments. Now it is in 2 installments. जिसमें at the time of registration and first ANC checkup, time of registration, at the time of registration, ठीक है, or and when she finishes 1 ANC checkup, she will get ₹3,000. Then second installment when baby registered and first dose of vaccines, ठीक है, first set of vaccines which is BCG लग गया, alright, BCG, OPV, Penta, all these are given, then they will get ₹2,000. Clear? That you must remember Pradhan Mantri Matru Vandana Yojana. But you know, if the second baby is a girl child, then we will give second baby is a girl child. Agar second baby, because Pradhan Mantri Matru Vandana Yojana is only given up to 19 years, guys. Okay, I mean for a woman who is beyond 19 years for first live born. But if second baby is a girl child, then we are going to give a single installment of ₹6,000 single installment. Okay, we are going to give 6,000 single installment. Am I clear? Alright, so this is it. And what is the ministry over here, guys? Ministry तुम्हारा क्या है? Ministry of Women and Child Development. This is under Ministry of Women and Child Development. Alright, so can you just give me one-liners for here? In the exam, if the question comes, increase institutional delivery, what is your answer? Increase institutional delivery. What is your answer over here? If we want to increase institutional delivery, तो answer क्या है? Which maternal? JSY. Very good. Janani Suraksha Yojana. Free service for pregnant and sick infants. Everything free. This is JSSK. Janani Sishu Suraksha Karyakram. Free screening for ANC females on 9th of every month. So if you talk about 9th of every month, this is Pradhan Mantri Surakshit Matritva Abhiyan. Labor room quality Lakshya. Train doctors and ENMs for antepartum and immediate postpartum care. Dakshata. Okay, train doctors for immediate postpartum or immediate intrapartum, like during delivery we need to have a trained person. And everything regarding this, a guarantee, charter, grievance redressal, 0 preventable maternal newborn deaths. Okay, women up to 6 months. This is what? Suman. Clear? So that's your maternal health initiatives. This I have made a slide for child health initiatives. You should go through this slide as well, guys. If you talk about home based care, ये important है. Home based care, home visits by ASHA worker, you must know. Home delivery में 7 visits है, 6 vaginal delivery, 5 hospital delivery. कब होता है guys? Day 1, 3, 7, 14, 21, 28 and 42 days. Rest you can just read it. Home based care of young child is also there, particularly for low birth weight babies after 3 months, like from 3 months onwards. Facility we have done. Indian Newborn Action Plan I had shown you in image based session. This I am going to give you a question right now. Rashtra Bal Swasth Karyakram. SARS program is to manage pneumonia. Guys, एक चीज़ याद रखना, SARS program के according chest in drawing is taken under severe pneumonia. According to SARS program, अगर exam में लिखा आ गया SARS program, although I will give you this when we talk about pneumonia, SARS program अगर लिख दिया, not RMNCI, if they write SARS program, okay, which is basically for the health workers as well, it is also in the field levels के लिए chest in drawing में we will club under severe pneumonia, but not under IMNCI. IMNCI में chest in drawing goes under pneumonia. I will tell you this. IMNCI के under pneumonia, chest in drawing is pneumonia. ठीक है, chest in drawing is pneumonia. In case कोई पूछ लिया SARS program, ठीक है. चलो, let's do the last set of questions. 10 more minutes to go. Under which national program is screening of children done by doctor as depicted in the image? Rashtra Bal Swasth Karyakram, it's written over here. We screen for 4 Ds, guys. Defects, deficiencies, diseases, developmental delays. Remember, a congenital glaucoma not screened, ठीक है, congenital glaucoma not screened, glaucoma not screened. And now we are almost 32 diseases थे, इसमें update ये है, update is that now TB, leprosy also screened, ठीक है, also screened, and we also screen TB, leprosy. We're also screening all these sickle cell, thalassemia, ये सब भी screen होता है. I hope you know Pradhan Mantri Poshan Shakti, guys. We have discussed in nutrition as well. ICDSB image based session में दिया हुआ है. हाँ, फोटो में लिखा हुआ है, फोटो में एग्जाम में नहीं लिखा होगा, ठीक है. ये किसका लोगो है? Discussed in image based. This is National Health Mission. Now the new name for National Health Mission is Pradhan Mantri Samagra Swasth Mission. Pradhan Mantri And you can see over here there's a couple with a child. Why one daughter? She looks like a girl only because we want to achieve NRR equal to 1. One woman should exactly replace herself with one girl child. So if this is NRR 1, this means we have achieved what, guys? Replacement level fertility. We have achieved replacement level fertility. And desirable TFR किसी भी country का क्या है? Desirable total fertility rate 2.1, which means we have achieved the 2-child norm. ठीक है, so image based से भी revise कर सकते हो. Okay, now we come to the last part, healthcare delivery system. A couple of questions. Your favorite ASHA worker, what is the answer to this? Mark the correct statements. Key health functionary of NRHM. So please remember, NRHM जो था ना guys, NRHM came in 2005. So did the concept of ASHA worker. Now everything is under NHM. NHM में NRHM भी है, NUHM भी है, National Urban Health Mission. Also you have RMNCAH+N. Also you have all the CDs, also you have all the NCDs. NHM is like the umbrella shining over us, the sun shining over us. So what are you answering? Proposed norm is 1 per 1000? No. Proposed norm is 2 per 1000. Existing norm is 1 per 1000. Okay, existing norm. Existing norm is 1 per 1000. Minimum 10th pass, yes. Preferably a woman of 19 to 45. 19 तो unmarried होते हैं mostly. 25 to 45 years. Accountable to village panchayat? Yes. So what is the answer over here? A, C, E. तुमने क्या आंसर लिखा है? Why only Nico, Nikki, Shalu got this correct, guys? No, Asha has to be. The question, you shouldn't make a mistake, guys. Please remember, Asha, according to our Government of India, Anganwadi worker, all of them have to be 10th pass. ठीक है, 10th pass, 25 to 45 years. Existing population norm is 1 per 1000. Proposed population norm is 2 per 1000. Selected by village panchayat. Okay, selected. Please check out the LRR. I have discussed this in detail. Selected by village panchayat, accountable to village panchayat. She is selected by village panchayat under supervision of medical officer. ठीक है. Identify the incorrect statement about Anganwadi workers. Acts as a link between community and health service. Responsible for the functioning of ICDS scheme in Anganwadi centers. Can immunize children and pregnant female. Anganwadi worker trained in is 12th pass. What is your answer? I just told you. Anganwadi worker is also 10th pass. आंगनवाड़ी वर्कर का ड्यूरेशन ऑफ ट्रेनिंग क्या है? नॉट सी गाइज. आंगनवाड़ी वर्कर कैन इम्यूनाइज. देखो एक बार, 10th पास आंगनवाड़ी वर्कर. ड्यूरेशन ऑफ ट्रेनिंग is how much, guys? Duration of training, just give me 1 second. Yeah, duration of training, she is dealing with children, 4 months. But Asha, guys, Asha also has to be 10th pass. Duration of training duration आशा की कितनी है? ट्रेनिंग ड्यूरेशन आशा की 23 days है. And Asha, everybody is trained by, she is trained by आंगनवाड़ी वर्कर और ANM. बट आंगनवाड़ी वर्कर को ट्रेन कौन करती है? मुख्य सेविका. ठीक है. आशा कैन नॉट इम्यूनाइज. डोंट मेक दीज मिस्टेक्स. आशा कैन नॉट इम्यूनाइज. आशा वैक्सीन नहीं लगाएगी. कैन नॉट इम्यूनाइज. आंगनवाड़ी वर्कर कैन इम्यूनाइज. ओके. आशा डिलीवरी भी नहीं कर सकती. Clear? And Anganwadi worker is the main person who's seeing all the Anganwadi centers where we run the ICDS program. One Anganwadi worker, I'll just add a slide over here. Please remember, Anganwadi worker, one Anganwadi worker in plain areas, all right, is for 400 to 800 population, and one Anganwadi worker for hilly areas, 300 to 800 population. We can also set up an Anganwadi worker on demand where there is no Anganwadi center but 40 children. ठीक है. We can set Anganwadi center on demand. All right. We can set Anganwadi center on demand. Asha, you all know existing population norm क्या है? आशा का existing norm, Asha is 1 per 1000. But if I talk about proposed norm, it is 2 per 1000. Clear? ICDS में 6 months to 6 year old, 0 to 6 years old बच्चे बैठते हैं, pregnant women बैठती हैं. Alright, now another important person is multi-purpose worker, male and female. What is your answer to this? Duties performed by male multi-purpose worker, guys. What is your answer? Maintain eligible couple register is the work of ANM. ANM is female multi-purpose worker. Collect sputum sample. Yes. ORS कोई भी distribute कर सकता है. Yes. Male also, female also. Malaria surveillance, of course, yes. Perform hemoglobin urine testing, ये ANM का काम है. So what is it that you came up with? 2, 3 and 4. Very good, guys. Please remember, these people are posted in a sub-center. So in a sub-center, you have a male multi-purpose worker, you also have a female multi-purpose worker. You will also call her as ANM, or you could also call them as health worker female, you can also call them as health worker male, and you have a safai karamchari. Now male and female both can distribute ORS, both can give contraceptives, both can inject vaccines, सब कर सकते हैं. But male particularly malaria surveillance every 14 days, collects sputum samples and also chlorination. और फीमेल मल्टीपर्पज़ वर्कर एलिजिबल कपल रजिस्टर मेंटेन करेगी, हीमोग्लोबिन यूरिन टेस्टिंग परफॉर्म करेगी, IUCD इंसर्ट कर सकती है, प्रेगनेंसी कर सकती है, रजिस्टर कर सकती है pregnant females. Alright, yes, ANM ही female multi-purpose worker है. They are all posted at a sub-center. Please don't get confused. ANM is same as female multi-purpose worker. Yeah. Okay, principal unit of administration in India, village, state, district, talukas. What is the answer here? Principal unit of administration India का district होता है. Planning is done at district level. Clear? Alright, next one. Mobile medical care provides services to all except primary health care, secondary health care, tertiary health care, near home based care. Mobile vans देखते हो ना, I also told you there's a mobile van for family planning which is known as सारथी. ये जितने mobile medical care हैं, they provide services to all except what? They provide services to all except tertiary health care. Very good. प्राइमरी सेकेंडरी सब में हो सकता है, बट नॉट टर्शरी हेल्थ केयर. यू वर गिवन इन चार्ज ऑफ हेल्थ सर्विस ऑफ अ नियर बाई स्कूल. टू होम शुड यू रिपोर्ट? प्रोवाइड रिपोर्ट्स ऑफ द स्कूल हेल्थ सर्विस. अनदर वे ऑफ आस्किंग. गुड, ऑलरेडी डिस्कस. स्कूल हेल्थ केयर इज अ रिस्पॉन्सिबिलिटी ऑफ प्राइमरी हेल्थ सेंटर. चलो, among the following first contact for people seeking medical care in a community is, guys refer to the LRRs please. In the beginning of LRR I have discussed healthcare delivery system in too much of detail, so I mean not too much, but whatever is needed you can go through that also. Yeah, first contact for people seeking medical care in the community. सब सेंटर है ना एट द लोएस्ट लेवल. इफ इन द ऑप्शन दे हैड आशा, दैट वुड बिकम द आंसर. घर से निकलते ही कुछ दूर चलते ही फील्ड में कौन मिलेगी? आशा मिलेगी. रूरल एरिया में ऊषा कौन होती है गाइस? ऊषा इज सेम एज आशा. ऊषा इज फॉर अर्बन एरियाज. ऑलराइट, एंड वन ऊषा प्लीज रिमेंबर इज 1000 to 2500 population. If you have to write one answer, it will be one Usha for every 2000 population. Clear? But अगर Usha आशा ऑप्शन में नहीं है, we'll go for sub centers. One PHC covers how many sub centers, guys? One sub center in plain areas is for 5000 population. One sub-center in hilly area is for 3000 population. One PHC in plain areas is for 30,000 population. One PHC in hilly areas is for 20,000 population. अब इसमें अगर आप देखोगे, so what is your answer that you are writing? 5 और इसको देखो 6 sub centers. Okay, don't go for the hilly one. 5 into 6 is 30, and one CHC supervises 4 PHC. They can ask you that as well. Which statement regarding PHC is correct? Primary health center is correct. Provision of total beds in a PHC is 4 to 6. One PHC covers 3000 in hilly areas? No. Hilly areas 20,000. Staff at PHC must have OBG? No, that's at CHC. PHC with more than to equal to 10 deliveries? No. Type A PHC क्या है? Type A PHC. It is PHC with more than equal to 2 and less than 20 deliveries per month. Okay, that is type A. What is type B PHC, guys? So that is more than equal to 20 deliveries per month. Of course total beds in PHC is 4 to 6. ठीक है, CHC में कोई ग्रेडिंग नहीं है. टाइप A सब सेंटर, type A subcenter, no delivery. But if I talk about type B subcenter, yes delivery. Okay, yes delivery do happen in type B subcenter. Next one, however, minimum number of beds in a CHC, guys. Can you tell me the minimum number of beds in a CHC? If nothing is mentioned, we will take as a rural CHC. Yeah, minimum number that we could have in a CHC is 30 beds. Clear? Actually देखो 30 to 50 हो सकता है, minimum पूछा है, so we'll go for 30 beds. Clear? Alright, let's go to the next one. Which of the following is not a part of urban healthcare system? So in urban healthcare system at primary levels, we do have a urban PHC, but we will never use the term sub-centers. We will be saying urban health and wellness centers. Urban health and wellness centers, which is for 1 per every 15,000 to 20,000 population, and urban PHC is 1 per every 50,000 population. This is at primary level. What is at secondary level? You have urban CHC, जिसमें तुम्हारा metro city, non-metro city. So if you talk about metro city, it is 1 per 5 lakh, and non-metro it is 1 per 2.5 lakh. Metro city में 100 beds होते हैं, guys. Non-metro city में we will have 50 beds. Also, which is the first referral unit? Can anyone tell me in the comment section? First referral unit क्या है? First referral unit. What is the first referral unit? Is it the sub-center? Is it the PHC? It is this. Is it the CHC? What is the first referral unit, guys? First referral, please remember CHC and upwards. CHC, sub-district hospitals, district hospitals, they are the first referral, okay? Alright, going to the next one. All are examples of grassroots level workers except. Grassroots level workers means those who are found at the field. So which is not an example of grassroots level workers? You have Ashas, you have Anganwadis, you have village health guides, you have trained birth attendant. The answer is ANM. ANM is posted at a sub-center, but still she visits the field at regular intervals. अगर option में LHV भी होता, okay, if option had LHV also, if option had LHV, please remember LHV answer हो जाता. Lady health visitor. Now lady health visitor is posted at a CHC, at a PHC. Okay, lady health visitor, PHC. Lady health visitor का दूसरा नाम health assistant भी है. Clear? She is posted at a PHC. 1 per every 1,000, 3,000, 1 per every 30,000 population. VHG क्या है? Village health guide. Village health guide. And you also have a TBA, trained birth attendant. They are all at fields. Trained birth attendant will conduct delivery. She need not be educated also. Alright, last couple of questions. What is true regarding urban community health center in an area? So I just discussed with you one CHC 1 to 1.5 lakh नहीं, बीच में ना एक polyclinic भी आता है. One polyclinic is for like 2.5 से 3 lakh population in the urban areas. 2 to 3 PHC, no. 4 to 5 PHCs. No district sub-hospital. District should be located. See, even if you have a urban CHC, you can have a district hospital sub-district. ऐसा कोई rule नहीं है. इसका आंसर क्या है? Minimum 100 beds. Alright, last question for the day. A 26-year-old Pregnant female visited the sub-center for a checkup. Which of the following test is done at sub-center during pregnancy? Please remember, it is hemoglobin. You don't do all these OGTT and USG. So you can go through this slide, guys. At sub-center, we do pregnancy detection, UPT kit से hemoglobin examination, urine test कर रहे हो, rapid malaria test कर रहे हो. PHC, CHCs में we start doing blood groups, VDRL, the triple test, VDRL, HIV, HBs, AG, rapid malaria, blood sugar. Clear? कभी भी मत बोलना blood sugar सब सेंटर, ग्लाइकोस यूरिया देख सकते हैं यूरिन में, बट इसमें नहीं. This slide is important for the day. Got it? I hope all of you know this chart. What is the name of this chart, guys? This name of this chart is growth chart. अगर 0 -2 SD, this is -3 SD. If a baby is between 0 to -2 SD, all road to health, everything is okay. -2 to -3, mild to moderate. But red zone आएगा, the baby has to immediately be referred to a CHC. Refer to CHC where you will find a pediatrician. And these are ICDS growth chart. This is actually ICDS growth chart that you have, the government of India has adopted from WHO growth chart. अब WHO growth chart में सिर्फ 2 lines होती हैं, guys. If you remember, it only has 2 lines. Obviously you are plotting age and weight. We do it for 0 to 5 years. Upper reference curve and this one is lower reference curve. Upper reference curve corresponds to 50th percentile for boys. In lower reference you should know is 3rd percentile for girls. तो WHO में सिर्फ 2 charts, 2 lines थे, and this was adopted by from a multi-centric growth reference study, जिसका इंडिया भी पार्ट था, मल्टी सेंट्रिक ग्रोथ रेफरेंस स्टडी. सो दिस आई हैव डिस्कस्ड इन योर LRRs ऑल्सो. यू कैन गो एंड रिमेंबर देयर ऑल्सो. देखो गाइज, इट्स नॉट वेरी डिफिकल्ट. द पॉपुलेशंस, इफ यू आर फाइंडिंग टू डिफिकल्ट, सी गाइज एक चीज़ बताती हूँ. आई विल टेल यू समथिंग, ओके, इन जस्ट 1 minute. इफ़ यू टॉक अबाउट सब सेंटर्स, you talk about PHC, you talk about CHC, रूरल एरियाज, ठीक है. सब सेंटर सबसे लोएस्ट है तो 5M3, 5M3. PHC 3 का 30, 1 का हिली में थोड़ा सा कम 20. CHC a lot higher, ठीक है. 4 you can have 6 2s are 12, 120. This is 180. This is rural area. For urban, guys, more population, so urban HWC instead of center 5-3 बहुत कम था. विलेज का साइज ही 1000-2000 होता है. 1 पर 15 to 20 के. अर्बन PHC कितना है, इसको जम करा के हाफ ले जाओ, 50 के. अर्बन CHC नाउ इन लैक्स, ठीक है. 1 अर्बन CHC 5 lakh and half of that 2.5 lakh. Finish. Clear? Got it? Everybody, did you understand? Chalo. Now numericals I will be doing once we have the numerical session. So we will discuss that in we will discuss that in numerical class. जो भी हमारा दूसरा numerical class होगा. Okay, so yeah, somebody was asking a question, no? See, Zooin, अब तुम अपने सोचो, Zooin is for zoonotic diseases, guys. It's a portal where we can report anti-rabies vaccine हो गया, मतलब dog कोई dog bite हुआ है या snake bite, कोई पूछ रहा था ना. I saw that question. Yeah, for the last revision, stick to your LRRs, stick to your sure shots. ठीक है, डोंट गेट कन्फ्यूज्ड गाइज. हु वाज आस्किंग अभी Zooin? आई मिस्ड योर नेम डियर. या सुवर्णा, 1 क्वेश्चन. देखो अब खुद सोचो, Zooin इज जूनोटिक इन्फेक्शंस के लिए. सो वी आर रिपोर्टिंग द डॉग बाइट्स, वी आर रिपोर्टिंग द स्नेक बाइट. इन केस यू डोंट नो इट, दैट्स हाउ यू कैन रूल इट आउट. क्लियर? Zooins, डॉग बाइट्स, स्नेक बाइट्स, उसके लिए Zooin. ठीक है, चलो, shall see you. Oh, one more thing, there's an update, guys. There's no class tomorrow. I have some work, so please look at this, guys. What we're going to do is, tomorrow का class जो है ना, National Health Program and Diseases, they will be taken as a compiled class for 1 hour 30 minutes, and this class will happen on 11th. It will happen at 10 a.m. guys. It won't be happening at 12 p.m. Okay, I'm not there, so I will be taking it in the morning itself around 10 a.m. Okay, so these two will be compiled. I will send out the list today only. Tomorrow and we might not be able to have a class. Okay, chalo, don't worry, I'll see you day after tomorrow. I'll send the PDF very soon. And thank you so much. Wallpaper, screen cover laga lo, anything that you have a doubt. Okay,